Ah, New York, the land of opportunities, the Big Apple, the city that never sleeps. The other side of New York, though, is the cold, dark, gray winters, where the sun sets as early as 4:30 p.m. When I first moved to New York in 2018, as the winter came, I started to experience seasonal affective disorder or seasonal depression, which at the time, of course, I didn't know that that's what it was. I wanted to get better, so I saw a therapist. It honestly didn't really help me, but I wanted to get better, so I just continued to go. And then as spring came, I felt better and I didn't see the therapist. And then the same thing happened again in fall and winter of 2019. I saw another therapist. I didn't think it was that helpful, just kept going, and then things got better as spring came around. As those years went on, my PCOS symptoms got worse. I would gain weight and I couldn't lose it. My mood swings were worse, acne, hair loss. You can see the full story on the video linked above. But then as 2020 came around, I started to learn more about my PCOS. I started to manage the symptoms and improve my insulin resistance. So I thought that, when fall 2020 came, things would be different, but unfortunately, it really wasn't that much better. And the good thing was that I was, more aware about it. So I sought out help earlier, and I did find a therapist where it did actually help me with cognitive behavior therapy, which I found to be really helpful. And the other thing that I was told to do was use a light therapy lamp, which is what this video is about. So welcome back to PCOS Healing Adventure with me, Dr. Ami Patel, pharmacist and fellow sister. Today's video, I'm going to share my experience with using a light therapy lamp and how to use it. Just a disclaimer for this video is for educational purposes only and is not medical advice. If you feel like you do have anxiety, seasonal depression, or depression, please seek medical help. This video is for educational purposes only. Women with PCOS are 3 times more likely to experience mental illness, anxiety, depression because of things like hormone imbalance, vitamin deficiencies, especially vitamin D, low neurotransmitters such as serotonin, and also the symptoms of PCOS such as weight gain, difficulty losing weight, acne, unwanted hair growth on the face, hair loss from the head can all lead to things like low self-esteem and poor body image and eating disorders, which all contribute to mental health as well. So this is the light therapy lamp that I use, and basically the way that it works is that it mimics sunlight, which causes your body to produce serotonin, the feel-good hormone, and also it regulates your circadian rhythm, which is known as the sleep-wake cycle. So it can also help you not feel so fatigued all through winter, or feel like you don't have energy, and it can help maintain your sleep cycle. Since you want it to mimic sunlight, you want to use it first thing in the morning. I like this lamp. It has a timer for 10 to 60 minutes, and it has different levels of light intensity. So in theory, if you use it at the brightest setting, you technically can use it for less amount of time. But then, if you use it at the lowest level, you should be exposed to it for longer. It's recommended to use for about 10 to 20 minutes per day in the morning. It may take about 3 to 5 days to see the full effects. Also, you want to be aware of not overusing it, because it can actually cause you to be over-energized and also can cause symptoms that are similar to mania or manic episodes, so you definitely want to be careful with that. Also, if you do use it in the evening, it might actually disrupt your sleep because your body is thinking that it's sunlight or morning, so you want to be aware and not to use it in the evenings or close to bedtime, but in the mornings. Since you want it to mimic sunlight, it should actually be angled so that it's hitting your eyes and your face, kind of like the sunlight rays, or kind of like the sun rays would hit your eyes. So if you have it on your desk, you can elevate it a little bit so that it's pointed down. And this lamp is nice because you can change the position of it, so I like that. And when choosing a lamp, you want to make sure that the face of it is pretty big, kind of like this one. You can get a small one if you travel a lot, but you just have to remember that if you do get a really compact one, you might have to be exposed to light for a longer period of time for that one, and you know, it's not hitting your body as much because of the smaller surface area. So you know, you can get one that's a pretty decent size like this one. The light that comes off of these lamps is 10,000 lux white cool fluorescent light. This is about 20 times more than any indoor lighting, which is why it makes it different than using any other, you know, random light, but specifically something that says it's 10,000 lux and is for light therapy. Also, you want to make sure that if you are going to pick one of these lamps, that it's free of UV rays. Last season, I didn't start using this lamp until January 2021, but this year, since I am aware of the trend that has happened to me for the past 3 years, I've decided to start using the lamp since October, so that's been going well for me. A few other tips to help with seasonal affective disorder are asking to get a vitamin D level check from your provider and then supplementing if you need. Another tip is practicing gratitude every day, just saying 3 things that you're grateful for from the day or day before. This really helps with your mindset and outlook on life. A few other tips are making sure you get rest and enough sleep, as well as do any sort of exercise that you like. Also work on things that you're passionate about or projects that you like doing that will help you pass the time. Another thing is trying to get as much real sunlight as possible, you know, bundling up and getting outside, walking in the sun. That's really helpful. One interesting thing that I learned is that if you have darker skin, you actually need more exposure to sunlight to get that vitamin D level up. So dark-skinned people like us, you know, just keep that in mind, that you may need more time in the sun, or, you know, more time using the light therapy lamp if you are going to use it. And last but not least, you know, it's okay to see a therapist or take medications if you need. So definitely seek medical professional help if you need, if you feel like you are experiencing seasonal affective disorder or seasonal depression. If you guys have any questions for me, leave them in the comment section. If you enjoyed this video or learned something new, give it a like. If you're new here, please subscribe to my channel. As always, be kind to yourself, be patient, and focus on progress, not perfection. Thank you. See you next time.